Thank you all for joining us for the inaugural webinar of the Evaluation Observatory. It's a platform for peer learning and knowledge exchange in the evaluation and impact ecosystem. I'm Sabina Matthias, Vice President at Sambodhi Research and Communications, and it's my honor to begin this initiative and welcome our very accomplished panel who will address the priorities and challenges of putting communities at the center of evaluation. Our moderator today is Sonal Zaveri, who is currently Regional Coordinator of GENSA, which is the Gender and Equity Network South Asia, a special interest group with the community of Evaluators South Asia, where she is a founding member. She's also co-chair of Eval Gender Plus. Our first speaker is Madhu Khetan, who is Program Director of Professional Assistance for Developmental Action, Pradhan, and she brings almost 3 decades of long learnings and experiences as a development practitioner. We should be followed by Pradeepnarayanan, who is Director of Research at the Praxis Institute for Participatory Practices in New Delhi, and he serves also on the International Advisory Board of the Community Development Journal. We'll round all of this up with Sita, Sekhar, who brings over 3 decades of experience working in governance initiatives with a focus on social accountability, monitoring and evaluation, and other related areas as a technical expert, training across the board on all of these things. She has also been an executive director of the Public Affairs Foundation, and we look forward to hearing how community building and community engagement actually work hand in hand. Over to you, Sonal.
Thank you so much, Sabina. And it's indeed my pleasure and honor to moderate the inaugural session of the Evaluation Observatory. I think the inaugural topic, putting communities at the center of evaluation, priorities and challenges, is so apt. It not only describes the value for community-led action and decision, but it also, in fact, describes the vision of the Evaluation Observatory, which Sabina just mentioned, to facilitate learning communities, to catalyze and capacitate the evaluation ecosystem in India. And by engaging us and you, all of us, in the shared journey. I'm sure you're going to agree with me when I say that community engagement in India includes a very strong civil rights movement with a very deep belief in inclusion, in learning from the ground up, and from project design to assessing to monitoring and evaluation. I think we have one of the richest resources, both human and technical, in the world about how to engage communities and why we do so. So I think COVID-19 also has reinforced that communities can and are taking measures for their well-being. And so if this is so, what is our role as evaluators? What value do we bring? How does the work that we do catalyze change that is fair, gender just, and cooperatively crafted? And why are we even having community dialogue and involvement? I think we measure what we value and we consider it ethical and very rights-based. And so I think as good evaluators, we do have to ask ourselves, what difference did a project make in people's lives, not according to us, but according to them? And we value those voices. So we have to ask to what extent do we question any community analysis or project design before we go into an evaluation, and how ready are we to admit what did not work? I think we are very, very fortunate today, as Sabina mentioned, to have very eminent thought leaders, Madhu Khetan, Pradeepnarayanan, and Sita, Sekhar. And they bring decades of very grounded experience and have elevated it to how we can use evidence to inform not a program or its results, but to also empower those whose lives are most affected by the intervention or the policy or the program, whatever is being studied. And I think that's a very fundamental value that our speakers will be addressing, the who's question, so famously stated by Robert Chambers about the people-centered community perspective, the right to be heard, valued, the right to make decisions affecting their lives. I'd like to also say that I think our understanding of community has broadened to include both virtual and geographical. And so one of the conditions of community is to share or have a common interest. I think is critical for all communities, virtual and geographical. So we have communities of practice like the Evaluation Observatory, that's virtual, and also the GENSA network, Gender and Equity Network South Asia, that I coordinate, and then bring people who are passionate about gender and equity to share and learn from each other. And I think we also have a traditional definition of community, which includes people, again, with shared interests, but living in the same place, a physical space. And from our experience, I think we know that this also needs further definition, that there are communities within communities too. So when we talk about community engagement, how do we measure? What are the innovative ways to do so? And how do we use technology and the digital space to do so? And I think we all know about the digital divide, that there are barriers for the engagement of people, especially women and the more marginalized. And how do we close that loop? Feeding the evidence and learning to review, revise, reconstruct our programs and interventions. And we agree these are not easy processes. With this, I'm going to introduce our first speaker, Madhu Khetan, with 30 years of experience with Pradhan, and in recent years, very deeply involved in setting up Pradhan's MIS very unique system because it involves women community data collectors who gather and share and learn from the information that they collect. So without further ado, may I ask Madhu to take the floor?
Thanks, Sonal. Thanks so much. And thanks, BMEO and Sabodhi for organizing discussion on this very important subject. As Sonal said, I will talk about not from only a evaluation kind of a perspective, but our our work around also using technology and other digital mechanisms to actually enhance development outcomes for communities. Starting off, I mean, a little bit of background about Pradhan. Pradhan started in 1983, and a little bit about the basic beliefs that we came with, because that has had a strong imprint on our development approach going forward, which is that we believe that people have the innate capability to be the drivers of change themselves. And our role as professionals, as external interveners, are to be the agents of change or the stimuli for change. But actually, the change has to be driven by communities themselves. And to be able to do that, communities actually have to have access to various other information, knowledge, etc., which probably, there is a current deficit around those. So therefore, we as those stimuli, one of our roles is also to make that available. To just give you a brief context, we work in the, as you can see in the map, if you draw an ellipse across the India map, this is where, bulk of India's poverty resides in this area. This is also happens to be the area which is mostly inhabited by indigenous communities. And this is where most of Pradhan's work has been over the last 35 odd years. So currently we work with around 800,000 families and with presence in around close to 10,000 villages. We've kind of, earlier we used to be, organized state according to administrative boundaries, but, over the last 5-6 years, we transited from that and organized ourselves into these clusters, which you see mentioned here, because we realized that communities actually relate more with other socio-economic, cultural connotations, which are, a little bit different from how administratively we have tended to organize ourselves. So these are some of the, areas of work that Pradhan is involved in. I will not go into the details of this, but this kind of provides a context to our discussion going forward. And of course, advancing gender equality is kind of integrated in all the development outcomes that we pursue as an organization. I will also not go into that. I mean, this is basically a mapping of, our work with the SDGs and how that is aligned to this. So basically, if we see, over the years, we've kind of made a conscious use to develop technologies which communities can use on their own to do their own decision making. So I'll just do a context setting. One is, back in end of 1990s onwards, we kind of developed this SAG based accounting software, which kind of made available the data from the SAG accounting data available to the SAG members themselves, so that based on that they could, to get a better sense. Then use of PRA tools in INRM or watershed planning, which has now also been adopted and used in the bottom-up panchayat level development process, development planning process. We also now using these kinds of applications for entitlement access, for things like groundwater data collection, family-based livelihood planning, and also for assessment by communities on status reports of how public infrastructure and services may be functioning, and lastly quality of life indicators through another application. So basically through various ways trying to make use of a community-led evaluation or access to various kinds of information. This is the the model for SAG accounting that I spoke about. So this is again mounted on smartphones or tablets, and it digitizes member transactions, which we know are numerous transactions, because each SAG meets like 52 times a year, and it becomes each meeting is attended by like 13 women. So it becomes a huge database, which in the lack of such a client-friendly kind of a thing can actually lead to members not developing the required trust. So over the years, we've kind of made also changes to this based on how it can be made more community friendly. And now I'll not go into the details of this, but as you can see, the entire system circles back to the community, collecting data from them, and then developing the required analytics, and then feeding back the data back to the self-help group, in order that women can then make use of the data to make decisions about lending, about savings, about dividend distribution, etc. And this is now also accompanied by an audio output, which kind of overrides the challenges posed by women, some women not being literate and therefore being able to read the written outputs. I'll now move on to, what Sonam talked about. Last 6-7 years, Pradhan has been involved in putting in place a digital-based MIS system, which, now covers all the geographies which are covered by Pradhan. Basically, the system consists of women from the community trained into collecting data directly from the households which are participating in various programs which are being run by Pradhan. And these women data collectors, and there are now around 1,300 such women data collectors. Each of them is equipped with a tablet or a smartphone, etc., and they collect data on various kinds of modules which are important, and through a participant recall method. So basically, this is the organizational theory of change. I'll not go into this, but this is, we kind of systematically looked at it and tried to see what are the various kinds of, outcomes that we are interested in, and then tried to design the MIS system so that we could collect data about things which are important to the organization in terms of development outcomes that we want to see in the communities. So this is a little bit about the system, which kind of makes use of a digital platform. It collects, there are these women CDCs who go out into the community and then collect data, which then goes into the digital platform, is then MIS platform, then makes use of the data to create various analytics, which then flow back to the community groups to actually provide them data around what are the various kinds of movements in terms of various programmatic areas. So currently, as you see, the entire system collects data on group health. It collects data on livelihood participation and also the scale of participation. It collects data on what are the movements in, knowledge recall, practice adoption, whether are there changes in the kind of outputs which are obtained, because we do a lot of work on agriculture practices. We also do data collection around, the kind of access that farmers are able to obtain and the kind of prices that they are able to derive for their outputs. We are also now for the last 2-3 years also collecting data around incomes, which is again, made available to the groups at the village level, so that they can actually see which households are kind of still lagging behind in terms of their incomes, etc., and therefore make more inclusive approaches moving forward. Lastly, I realize that I'm running out of time. Last 2-3 years, we've also looked at, beyond economic prosperity, actually are kind of people also being able to access a better quality of life. So we kind of making use of methodology which actually looks at comprehensively a set of indicators which measure quality of life across 12 themes, which again, this report card is again mounted on the same platform, and it actually provides data on quality of life across the, and this is especially also been tested in the context of panchayats. They're supposed to perform a lot of important roles in, last mile governance bodies, but do not actually have access to a robust MIS. Many states have put in place some measures, but we still do not have an integrated system. Actually tested it in the context of panchayats, actually making use of this database to actually see which wards are, kind of advancing and lagging behind. And of course, organizations like Pradhan and others can also make use of this. This has been piloted by an organization called Ideas Unbound. So basically, yeah, I think I'll stop here and handing it back to Sonal. Thank you.
Thank you so much, Madhu, and for keeping the time. That was very kind of you. And thank you for that very fascinating journey from conceptualization to execution to learning through real-time data gathering and decision making that really reflects the reality of people's lives. My pleasure to introduce the next speaker, Pradeepnarayanan. He's the Director Research of Praxis Institute for Participatory Practices. And he is both a practitioner of participatory methods and approaches and also contributes to the thinking and the literature on it. He's co-authored a book, Participation Pays, Pathways for Post-2015. And he's going to talk to us about change and which change matters. Over to you, Pradeep.
Yeah, hi, good afternoon, everyone. Yeah, thank you very much. Thanks, everyone, for this opportunity. Presentation is based on a experience of one rapid participatory monitoring appraisal, which we did between the first wave and second wave in one of the villages in Tamil Nadu. So I thought I'll share this thing. This has around 14-15 slides, but I will. The idea here is to give an experience of that. So I will not go into details on each of the slides. And only at the end of the slide, I will reflect on some of the experiences which we have. Thank you very much. So this is about, this is a very common thing called in Tamil, what is Nalu peru enna solvanga, means oh char log kya kahenge, 4 people, what will the 4 people say? It is about reflection of the power of the society over the program. And we wanted to assess that part of it. And the village is, I have changed the name of the village. It's a Gopalapuram village, and largely around 450 families, and with 150 families belonging to a couple of dominant castes. There are 60 Dalit families, and there are also sex workers in that village. And the program is largely about organic farming and introducing, because the government schemes on organic farming have not been utilized by the people. So the program was like more about farming farmers group, training them on organic farming, And year 3, we saw that women farmers group got formed, and year 4, we saw the program entering into the Dalit colony and forming Dalit farmers group. And then year 5, we saw a lot of training on gender and sexuality rights and entitlements to all group. So while we were this participatory rural monitoring appraisal has a set of process, which is the first set is about reflection, which is about what change the programs brought to the beneficiaries. Then the second set of reflection happens about the changes which happened in beneficiaries, how it has influenced the wider change in the society. And the third one is key inferences, key insights about program, what it needs to focus, and who owns the program. And the participants in this appraisal was initially just about program team, volunteers and beneficiaries. Then we went beyond community members, beyond beneficiaries. And then the program team volunteers, again, we came back and did a reflection with them. So we use a lot of participatory methods, which is card sorting is an important tool where we just map the beneficiaries, just gives the, if I can put it like an MIS put in cards. So where we measure number of groups, number of members, and how many leaders formed, how many farmers were introduced into organic cultivation, women participation, Dalit participation. In that way, we made the group made a list of all the achievements which they had. And then we also did a kind of a rough assessment of the same in terms of community mobilization. So you can see that the group actually reflected as strong in terms of community mobilization, farmers being introduced into organic cultivation, Dalit participation, and women getting into high savings, economically empowerment, and mobilizing the government support. Then we did what is called as River of Life, which we generally do for all the programs, which many of you must have also been done. Then we saw that year 1, 2, it was largely for male farmer group and only dominant caste. Then year 3, we saw the women farmers getting into the program, saw that deficit. So they moved into women's group. And then year 4 and 5, we saw that Dalit farmers groups are getting formed. So literally the reflection was that program is dynamic and is becoming inclusive step by step, and it is responding to the reflection exercise. So it's a learning program in that sense. Then we started the reflection B, that is we went to the community members and started talking to some of them. And the key domains which we selected was agriculture, gender, and caste. And in each of these, what we try to do is we first ask the group actually to list all the problems which they generally present in these domains. And then we ask whether these problems still exist. And then we ask them whether the problem was supposed to be addressed by the program or not. So if you see the issues of farmers, which came in, is about challenges in leveraging government schemes for farmers. Farm inputs and markets are controlled by the industry and large farmers, landlessness among Dalits, indebtedness among farmers, agri-land shifting for industrial purpose, and youth moving away from agriculture. These are some of the important issues which the farmers listed. And what we found was all of these problems still exist. And probably only the leveraging the government schemes for farmers have challenges have decreased. So that is one big spot where we succeeded. And most of the other places is largely status quo. And then we moved into the gender issues. Again, gender issues are early marriage, wage disparity among women, dowry system, no property right for women, ritual inferiority of women, lack of mobility of women. These are some of the issues which they came out with. Again, we asked that whether these problems exist or anything. We saw that most of the problems are continuing to exist. And only, in fact, early marriage, because of the COVID, etc., it has actually increased in the last few months. So that is something I would say. Then we again asked them to list something on the caste issues. So similarly, caste issues are landlessness among Dalit, narratives about when non-Dalits participating in Dalit weddings or into Dalit colonies, there is any discrimination, honor killing incidents, disallowing funeral on common funeral areas, separate funeral sites, or disallowing in festival ceremonies. So we can see that the problems actually still exist, and most of them are status quo. And because of the COVID, some of these caste issues came out in a much more prominently. Then literally we did a collation of these things, and what we tried to find out is the program has actually supporting changes among beneficiaries. It is at the level of good, whereas the changes in beneficiaries influencing the change among societies was almost negligible. So this raised the question that we are able to benefit, we are able to contribute to the lives of many people, farmers in it, but overall social structures, social things are not necessarily keeping pace with that particular change. So then we asked, what is the key participation question here is about to understand that when there was no pressure on the program on farming neither included the women nor included the Dalit farmers, despite the fact that the women farmers contribute quite a lot in agriculture and agricultural laborers largely coming from the Dalits. So you would see that when there is no pressure, the program is largely focusing on the dominant caste. And even when women were included, there were largely Dalit women, none from the sex workers community. So why? So that begs us to ask the question, to whom this program belongs to? This is the question which is about the participation part of it. So then we tried to map, like there is a large participation of community which was taking place in the decisions making of because these groups were quite vocal and they were able to do a lot of things. They were able to do a lot of research, etc. And in fact, collect exercise, and they submit to the government and access the schemes. So in that way, we found that there is definitely the NGO-led, it is moving into the beneficiary-led thing, and issues which are getting prioritized is about the beneficiaries. But then we thought that we should ask the question about why program decided to have caste-based or gender-based groups? Why there are less of a mixed group? Why not encourage sex workers and women to form a common group? Why not encourage the dominant caste and Dalit forms to form a common group? And I would say we see a large kind of responses were coming into the category. One is a category of conservative, who says the program should work within the local system. Don't really try to disturb it. Then there are rational people who say that the organic farming is largely about the landed farmers who are about dominant caste. So that if you need to achieve the program objectives, you have to focus on the rationally. That is the right thing. Moderate is about you should go slow. Don't be very radical. Go very slow, train them, sensitize them, and then move into the thing. Or even liberal. Liberal will talk about what about if we focus only on Dalits? What about the children of the dominant caste? What about the women of dominant caste? So we have to ensure that everyone gets benefit. And what we found is all these four voices looks very, very good, very reasonable, but none of them actually challenge patriarchy or casteism. I would say that when we define community participation, we have to define marginalization first and find out that the program actually, what is the power relationship within the society. Often community participation may reinforce the patriarchy and the caste system. So you have to be very clear of it. And as evaluators, should be not introspective. We have the characteristics of these four people, which we talked about. If we have, we should not refrain from calling ourselves as Brahmin or patriarch.
Thank you, Pradeep. And thank you so much for that deep dive into the case study. I think we got a very close look at what works, what doesn't, and using a PRA so thoughtfully to understand intersectionality and indicators that make sense to communities and where change was being assessed either positive or negative. And I think you raised a very important question, asking the who and the what. Who does the program really belong to, and how transformative is the change? And asking that question, which is so difficult to answer, power structures, inequities, and how much have we been able to chip away at it? Thank you so much for that insightful presentation. Let me introduce Dr. Sita Sekhar. She is currently an independent consultant, but she was the executive director of the Public Affairs Foundation, PAF. And she led that organization, and among many of the initiatives that she headed, was related to social accountability based on the citizen report card approach. And she's going to share with us these social accountability tools, measures, and some of the learnings from them. Over to you, Sita.
Thank you, Sonal. Thank you very much, Evaluation Observatory, for giving me this opportunity, first of all. I'm going to talk about community engagement as a part of social accountability and what role it plays in that. I will be telling you about social accountability, its context, rationale, and the different methods and tools that are available on those. This is just, I just wanted to start on a very light-hearted but profound note to say that what goes into, we could describe this as a governance machinery, and there is a lot of resources going in at the top, and with leakages steaming out, as you can see, through the machinery, and then finally the citizen getting very little of what is being passed around. So this then we call the governance deficit. Now, why is there a governance deficit? These are the key reasons why there is a governance deficit. One is that the civil society is dormant. The other could be that there is an abuse of discretion. Third would be a weak accountability in the system, in the service provision, which then leads to corruption as well. There is non-responsiveness among the service providers who do not respond to whatever issues are raised by the users of that service. And then, of course, there is inefficiency in the way the service is delivered. Now, how does one address the governance deficit? And one way of doing it is with the use of social accountability measures. Social accountability, there are various definitions available of social accountability, but I'll just go through very quickly two of the definitions that I have picked out. One is the broad range of actions beyond voting that the citizens can hold the state to account. They can use those and hold the state to account. And there are certain, it could be actions on the part of the government, civil society, media, or any other of the stakeholders. The other definition, which is very simple but very precise, is about how social accountability is an approach towards building accountability that relies on civic engagement, in which it is ordinary citizens or civil society organizations that participate directly or indirectly in exacting accountability. If you want to know more about this, you could always refer to the link that I've given here, which will be shared with you later. There could also be there always is internal accountability mechanisms in government, which takes various forms like political, fiscal, administrative mechanisms, and legal mechanisms. But there are certain critical success factors that make social accountability count. And those are, it could be the underlying political, legal, social, cultural, and economic factors, which would be the key for sustained impact. And it is important to suit the context, these methodologies to suit the context. There are various tools. Of course, there are just about 11 of these that I have listed out here. There is a citizen report card approach, there's a community scorecard approach, participatory budgeting, budget analysis, public expenditure tracking, social audits, which are very popular, citizen charters, which are now mandated by the government for every department to come up with, public hearings, or Jan Sunwai as they are called, appointment of ombudsman or the Lokayukta, citizen juries, as well as use of community radio. So in this particular presentation, I'm going to just, very quickly tell you about two of these methodologies that I have used a lot of, and which is the citizen report card and the citizen and the community scorecard. In the citizen report card, the approach is survey based, where we do a survey of users of certain public services, which are basically provided by the government, and the people do not have a choice to go to any other provider for. And these services are provided by the government, and we do a survey of the users to understand what are the different issues that they face, to understand how these services are provided. Various aspects of service delivery are covered in this. And then the services are rated largely on satisfaction, on responsiveness, on the way the services, the quality of the services, and so on. Once the ratings are ready, these are shared with the different service providers or the agencies that provide the service. And then there is civic engagement or citizen engagement in the reforms that are brought about collaboratively by the citizens as well as the government agencies. And of course, this is then done on a sustained basis, which then goes through periodic benchmarking and public review, which leads to improvement in certain services. This then is a citizen report card, and this is a methodology that can be used to largely to get an idea of how services are provided across large geographical areas and large different types of service users and service providers and so on. The community scorecard approach, which is the second approach that I'm going to tell you about, is something that is used to assess services at the utility level or at the very local level. And the community and the service providers come together to understand the problems that are faced by the community and the problems that are faced by the service providers, and come to an understanding on how these services can be changed or improved, what changes can be made to improve the services at the very local level. So it could be, the Anganwadis or daycare centers run by the government. It could be primary schools that are, run by the government. It could be health centers at different levels or at different locations that are run by the government. So the method includes 7 key steps. You have preparatory groundwork, which of course, I guess every methodology involves. There is input tracking, where one understands what are the inputs or what are the ingredients that go into the provision of the service, what is the status of all of these inputs in the utility that we are assessing. There is a performance scorecard by the community, which evaluates, comes up with various indicators of the service delivery and the quality of service. Service providers evaluate themselves or do a self-evaluation, trying to come up with indicators and rating themselves on those indicators. The two, that is the community and the service providers, are then brought together in the interface meeting, where they then try to interact with each other, bargain, or make the other understand why the score has been given by them. And then they come out with consensual, or they come up with a score which is arrived at by the two of them, and then they come up with an action plan, which then is then executed to understand how things can be changed, and change is brought about to improve the services. And of course, the institutionalization of this methodology leads to a lot of change in an improvement in the service delivery, as well as how the community plays a role in service delivery improvements, and how the community monitors the services by itself or gets empowered. So here are some examples of how the citizen report cards and community scorecards have worked in various contexts. For example, there was a study that we did of in the Sundarbans area of West Bengal, where we did an analysis or evaluation of Anganwadi centers or daycare centers run by the government. And we found that the mothers realized that they have the power to improve the services. The food that was being provided, the khichdi that was being provided to the children, was of poor quality, it was liquidy, and it was not nutritious. And they went and this came out through the community scorecard that was conducted there. They went and monitored the making of this food in the afternoon, and then onwards, the quality of the khichdi that was given to the children improved dramatically. Another example of the use of the citizen report cards is in Bangalore, where the Public Affairs Center conducted various citizen report cards over a period of time, which led to competition among municipal services. So we would get calls from the service providers asking us, when is the next report card coming out, and we want to be ranked first. So that kind of competition to improve their services happened from the service provider side as a result of the citizen report card. There was also, if you want to look at an international example, there was a cash transfer program run by the government in Tanzania, where this cash transfer program for the poor was evaluated using both the citizen report card approach and the community scorecard approach to understand the way education, health services, and drinking water services are provided to citizens. And this led to, feedback on how the program was doing. And that feedback then led to the government running the program in a more efficient and very useful manner. Thank you.
Thank you very much to all our speakers. And thank you so much for keeping the time. Those were all amazing, very, very thought-provoking presentations about community engagement, dialogue, use of so many tools, and also about how communities have adapted to and learned from it, and how others have learned from it as well. And I think we learned a lot about how communities are being nudged towards a virtual COVID world, but a digital world as well, and how tools can generate meaningful evidence, can ask uncomfortable questions about power. And so I think this whole issue about change, that is not necessarily transformative change. And I think that's really critical, because SDGs are constantly saying, leave no one behind. And they're asking who is included, who is not, and why. And I think that has been so well addressed in all the three presentations. And I think that has also led to a question that I often ask when we gather evidence. Well, so what? So what are we going to do with this evidence? Are we addressing structural barriers to inclusion? Are we being gender just? And I'm using the word gender very, very broadly, mindfully, being intersectional, caste, class, religion, disability, age, and so on. And so that comes to, contemplating and asking together, what is our role as evaluators? That's really critical. And we do play a very important role. One foot with the communities and the other with funders and commissioners of evaluation. So with the community, we are facilitators. And we do that very well, and being rigorous and yet having a sensitive understanding and empathy with the community. And this has been beautifully brought out in all the three presentations. And I often say that words matter. How do we represent our community members, not as beneficiaries, but partners? I think that was very clear in all the presentations. But I think we also need to do a little more with commissioners and funders. And although we do get a brief to do the evaluation in a certain way, we do have windows of opportunity to include difficult questions related to gender, equity, marginalization, and that community engagement and dialogue is not optional. It is not anecdotal. It is qualitative, but extremely rigorous. And I think we need to change these mindsets. And particularly now when we are faced with a number of tools that are very survey-driven, pen and pencil, very expensive, the RCT's model. And I think we need to advocate rigorously, not just that we are engaging communities in dialogue, but the tools that we have are equally rigorous. And I think in this current scenario of very, very short funding cycles and target-driven projects, I think the funders want to evaluate these efforts into very neat tick boxes and easily forgetting that we are making fundamental changes in people's lives. And I think we need to value that, cherish that, and elevate it to the importance it deserves. And I think we also need, I often say again that we have a management response to recommendations. Well, how about community responses to findings and recommendations? And hopefully, I'm the eternal optimist, and I hope that will be standard operating practice in all evaluations. I just want to end the talk by something that's very, very dear to what I do, and it's talking about India and India's space in the global South, and how we can bring our very rich learning that we've seen today to the global evaluation agenda. So while we talk about power in communities, with communities, evaluators, and funders, there's also power when we discuss about whose intellectual space is being recognized in shaping the global evaluation agenda. And I'm sure that these dialogues, the sharing our knowledge, our expertise, what the Evaluation Observatory is doing is going to enable our voices of evaluation expertise to have a platform, and we are off to a promising start. Thank you for all of our speakers providing us our time and their shared wisdom. With that, may I open the floor to questions? I'll be choosing as many questions as possible. So if you want to direct your questions to a particular speaker, please do mention that as well. So I'm just going to go over some of the questions that have come through. So one of the questions that is there is that for Madhu, is that could you say a bit more about the feedback loop of data back to communities? And this is quite unusual. And do you have any examples in the way communities have used the data and for what?
So various ways, Sonal, in the different examples that we said. One is the very basic is the, the example on the hisab, this thing. For example, in that, what happens is that every week, what the SHG, transacts is a lot of, financial transactions. Now, it's almost like a small bank which the women are running. So, and for that, many times, complex lending decisions, etc., require that kind of a sophisticated, thinking through, and to keep track of, things like lending and whose loan is becoming due, how much interest, etc. So all those things, there's a feedback loop which goes back. In other things also, in the CDC model, for example, there's a feedback loop again after the group module, flowing back to the village organization, in the sense of that, in our village organization, there are, 20 groups, but actually, the health of the 20 groups is kind of a differential. So there are 4 or 5 aspects on which the groups are kind of, they're kind of assessed. So there's a, it provides an opportunity for the village organization to sit back and reflect on how actually, this, why is this happening, and what they can do with the differential, performance of the this thing. Then similarly about the livelihood participation also, in terms of, why are, some people not able to do tomato cultivation, etc., or why are practice adoption, etc., vary, etc. So some examples like that.
Thank you for that, Madhu. And there are lots of questions, and I'm just choosing a couple of them. So my apologies that I cannot address all. This one is for Pradeep. Do you have any examples where the community determined or provided inputs to framing the questions? I think they're asking the evaluation questions itself and the methodology and the use of the findings for their benefit.
Yeah, there are a couple of examples. One is that's what I also replied in the thing, that there are 2 scenarios which happens. One is where there is a presence of organized community group. If you have an organized community group, then probably you can reach out to them to help you with indicators as well as the frame and design. Otherwise, if there is no organized group present, like for example, we did the same with the sex workers group as well as with the LGBT community, because there is an organized representative. But in other scenario, it becomes very difficult. You might have to cherry and pick certain community members, and that cherry picking actually creates bias, etc., etc. And for dissemination, there are methodologies like ground level panels, which we organized. When the United Nations came with high level panels on SDGs, we organized what is called as ground level panels, where the expertise they had is that they are currently living in poverty. So in that way, we can always come out with the new methods of evaluation. Thank you.
Thank you, Pradeep. This is a question for Sita. So what is usually the level of engagement of citizens in bringing reforms in service delivery? And is the feedback usually accepted by the service providers? I'm also going to add another question to that, is that the feedback to the system, how do you make sure it's constructive and not critical in nature?
So what happens is that when the community gets to know, people generally talk about all the problems, like to talk about the problems that they face and how they're having difficulties. So we don't have problems with people participating when it comes to service, delivery assessments. The community is very participative, and sometimes it's quite surprising to see the kind of fervor and enthusiasm with which they question the service providers, especially when the community scorecard is used. There can be a little bit of a difficulty as well. So the community is also very feels very empowered when they get to bring about a change on how services are provided to them. As far as the service providers are concerned, largely they are also aiming at improving their services. So some of them are really very proactive, and that's what I have answered in the question Q&A comment section as well. Some of them are really very proactive, and they like to proactively get us to do the evaluation so that they can measure the impact of some of the reforms that they have brought in individually, some of the leaders of service providers. Then your question, the additional question that you asked about, sorry, can you just repeat the question?
About being not critical.
So when we talk about, any of these methodologies, we always use the phrase, we pat and we slap. So, when they are doing well, we appreciate them. So it is not just about criticizing what they are doing, but it's also about appreciating whatever is going well. So that feedback kind of enthuses them. And then we go on with talking about, what is it that needs improvement? And it's in a very constructive kind of manner. So it's generally accepted. There are, of course, cases where it is not accepted, and one has to work harder at convincing them and, kind of go different routes in trying to get to people who will be receptive to what you present.
Okay, thank you for that. We are 2 minutes beyond our time, but we started a little late. So I'm going to take the liberty of having one question, which is open to all the speakers, but please have just 30 seconds for your answer. And this is really a great question. So speaking truth to power has always been a tricky part. Any suggestions as to how to go about disseminating the findings to the authorities and stakeholders?
So we've taken, a collaborative approach, especially at the cutting edge between, I can take an example of panchayats and, women's collectives. That approach has, has worked well, wherein their people, communities, and women as representatives of communities, and panchayats as stakeholders of the local area, they collaborate in more meaningful ways and take stock of the development of the area. That seems to be, be working well in certain areas.
So I would just say, involving all stakeholders and, getting each of them to look at what works for them and coming together, the collaboration among all of them, that's what works.
Let us just acknowledge that we are also part of the same system in which the way that truth is defined and all. So what is truth and what is not truth is something which is a very difficult thing at this point of time to decide. And we are also probably in a situation globally where truth and evidence may not matter as much as we try to fight it out. Yeah. Thank you.
So on that note of collaboration, dialogue, engagement, and a wake-up call,
Caution.
truth and evidence, I think we have come to the end of our webinar. And I want to thank all our speakers again. And I want to thank Sabina and her entire team for their tireless efforts in working with us to get this webinar off the ground, this inaugural webinar. It's been an honor to moderate it. Over to you, Sabina.
Thank you so much, Sonal, Sita, Madhu, Pradeep, for such wonderful insights and for the first time to actually even bring together engagement and participation together. And not just as a community of practitioners, but the communities we engage with. I think that is such a grounded conversation that we've had today. And thank you so much for that. I'd like to invite everybody who's participated and say thank you again to them. This has been so lively and it has been a wonderful job keeping up with your questions. Thank you for sharing them. Thank you all so much for joining us today. You've been an absolute delight. Thank you.